Heart failure definition. Heart failure is a clinical syndrome in which the heart is unable to pump sufficient blood to meet the metabolic needs of the body, or can do so only at elevated filling pressures. 5 types of heart failure. 1. Left-sided heart failure. 2. Right-sided heart failure. 3. Congestive heart failure, CHF. 1. Left-sided heart failure definition. Left-sided heart failure occurs when the left ventricle fails to pump blood effectively into the systemic circulation. Causes: hypertension, most common cause; coronary artery disease; myocardial infarction; cardiomyopathy; valvular heart disease; aortic or mitral valve disorders; arrhythmias; in pathophysiology; left ventricle fails; blood backs up into left atrium; increased pressure in pulmonary veins; fluid leaks into alveoli; leads to pulmonary congestion and edema. Clinical features, symptoms, and signs. Pulmonary symptoms dominate: dyspnea, shortness of breath; orthopnea, difficulty breathing when lying flat; paroxysmal nocturnal dyspnea; cough with frothy sputum; pulmonary crackles, crepitations; fatigue and weakness; tachycardia; cyanosis in severe cases. 2. Right-sided heart failure definition. Right-sided heart failure occurs when the right ventricle fails to pump blood into the pulmonary circulation. Causes: left-sided heart failure, most common cause; chronic lung disease, COPD, pulmonary hypertension; right ventricular myocardial infarction; pulmonary embolism, congenital heart disease. Pathophysiology. Right ventricle fails. Blood backs up into systemic venous circulation. Increased venous pressure. Fluid moves into body tissues. Clinical features: systemic congestion dominates; peripheral edema, feet, ankles, legs; ascites, fluid in abdomen; hepatomegaly, enlarged liver; jugular venous distension, JVD; weight gain due to fluid retention; nocturia, anorexia, and nausea. 3. Congestive heart failure, CHF. Definition. Congestive heart failure is a condition where both left and right sides of the heart are failing, leading to pulmonary and systemic congestion. A features of CHF combination of pulmonary congestion, left-sided, peripheral edema, and venous congestion, right-sided. The common symptoms: severe dyspnea, generalized edema, anasarca; extreme fatigue, reduced exercise tolerance, cold extremities, decreased urine output. Causes of heart failure: overall, cardiac causes, hypertension, coronary artery disease, myocardial infarction, valvular heart diseases, cardiomyopathies, congenital heart disease; non-cardiac causes, anemia, thyroid disorders, chronic kidney disease, diabetes, mellitus, infections, excessive fluid intake. Clinical features like left-sided HF, right-sided HF, dyspnea, peripheral edema, orthopnea, ascites, pulmonary crackles, hepatomegaly, frothy sputum, JVD, fatigue, weight gain. Management of heart failure. A. Medical management example. 1. Diuretics, furosemide, reduce fluid overload. 2. ACE inhibitors. Enalapril, lisinopril, reduce afterload and improve cardiac output. 3. ARBs, losartan, alternative to ACE inhibitors. Beta blockers, metoprolol, carvedilol, reduce heart rate and workload. 5. Digoxin, improves myocardial contractility. 6. Aldosterone antagonists, spironolactone, reduce sodium and water retention. B. Lifestyle management, which is a low-salt diet. Fluid restriction, weight monitoring, smoking cessation, regular mild exercise, avoid alcohol. C. Nursing management, which is monitor vital signs, daily weight measurement, strict input-output chart, assess edema and lung sounds, patient education, position patient in semi-Fowler's position. D. Surgical management, if required. Example: valve repair or replacement, coronary artery bypass graft, CABG, pacemaker or ICD, heart transplant, end-stage HF. Complications, which include pulmonary edema, renal failure, arrhythmias, cardiogenic shock, death.